Hi, my name is Chip, and I'm a paramedic instructor in North Carolina. I'm here today to talk a little bit about what you can do during a diabetic emergency. A diabetic emergency is something that's going wrong with the body in relation to the sugar content, whether there's too much sugar, not enough sugar, or maybe there's sugar that can't be utilized by the body very well. So you have a high and a low sugar emergency. Sometimes they can present very similar. The biggest difference is with your low sugar emergencies or hypoglycemia, that's typically going to be very fast onset. For those individuals, for some reason, they don't have enough sugar that can be used in their body, and your brain and your body require two things, oxygen and sugar, to make sure that they stay alive. So if you take either one of those two away, you're going to have a lot of problems very quickly. If you recognize someone that's having a low sugar emergency, and that can be they'll have slurred speech, almost sometimes looking like a stroke, but they won't have weakness on one side. It'll typically be both sides. Sometimes they can be very violent and combative as well, and that's because of the irritability to the brain for lack of sugar. Sometimes they'll be unconscious. If they are conscious and they can swallow, if you can give them some kind of a sugar-type substance, that can be any kind of a sweet drink. You want to make sure that they drink it slowly, maybe with a straw. You don't want to give them anything that's diet, because obviously there's no true sugar in diet drinks. It's all some kind of a false sugar, which isn't going to do them any good. If for some reason they can't swallow or you don't think they can drink, you definitely don't want to try to put anything in their mouth by yourself, because if you try to pour something in there, they could choke and aspirate and have more problems from that. So if you can't give them more sugar substitute, then you need to go ahead and make sure that 911's on the way. For high sugar problems or hyperglycemia, it's a little bit different. There's not a whole lot you can do as far as a layperson to treat that. They need insulin or some other things to help take care of that problem. Usually that's going to take hours or sometimes days to present itself. The biggest thing is try to talk to these people, if you can, and find out if they have a history of sugar problems, so that'll better guide what you need to do. This is Chip, and I hope we've helped you identify and begin initial basic steps of treating sugar or diabetic emergencies.